Hello, my name is Victoria. I'm going to be a student nurse today. First off, can you verify your name and date of birth for me, please? Alright, Amy Smith, 1893. Alright, Miss Amy, do you have any allergies of any concern? None at all? What about penicillin? You do? Okay, alright. Any allergic to shrimp or anything? Okay, great. Alright. Okay, so how are you doing on that pain scale with that pain medication I administered to you 45 minutes ago? On a scale of 0 to 10, with 10 being the greatest, 0 being the least, how are you feeling? A 1? Okay, great. Okay, well today we're going to be doing your wound dressing, alright? Okay, first off, I'm going to give you some privacy. I'm going to go wash my hands. Alright, I'm going to gather my supplies. Okay, I'm going to go ahead and raise the bed to a comfortable working height. I'll raise the bed for that, and I'll let this rip down. Okay, then I'm going to apply my clean gloves. Alright, let me go ahead and move everything back so that I can have great access to the wound. Alright, and I'm going to go ahead and take this off, pull it towards the inside, keep my hand here so I don't mess up the skin. While I do that, let me go ahead and get my bag out. Take this off. Okay, and when I would take this one off, I see that he has a little serous drainage. There's no pink or red, which is a good sign. There's a scant amount of drainage, and it was a slight odor, but it's not too much. I'm going to go ahead and throw that away. Right, and let me check these 4x4s. Okay, I don't see. It's a scant amount of drainage down here too, and it's serous as well. It's a slight odor, but it's not too much. It's not saturated. Same as there. Looks pretty good. Let me check the gauze. I see 2 that are in here, and they're pretty saturated, but it's serous as well. A little pink around the edges of the wound, but the borders look pretty regular. There's no concern there. It's a little pink, sign of, healing. There's no issues there. Okay. Okay, now we're going to go ahead and disposal of these soiled gloves. Okay, and I'm going to prepare my sterile field. Outside, be careful that I don't reach over it. I'm going to pull this back to the side, and that part is no longer sterile. I'm going to take my gloves out, place them here, and take this out because I don't need that. Alright. Now we'll go ahead and pour my solution. Make sure I don't splash it and I don't put it into the container. There we are. Okay, and I'm going to put on my sterile gloves. I can touch the 1-inch borders, which is what I'm doing. Straighten it out. And I'm going to grab the right hand glove from the inside, because that part is not sterile, but the inside is. Be careful not to touch the outside. Have that one on. Now I would grab from the bottom of the inside on the left. Slide my hand here. Okay. And clap them like this. Okay. And since this part is there, I'm going to go ahead and move that out the way. Okay, I'm going to go ahead and take these Q-tips off so I can reach my other areas. And this part is sterile, so I'll place it here. Okay. And now I'm going to go ahead and clean. With this. Squeeze it out so I don't want to drip it everywhere. I'm going to clean from the least contaminated area to the most contaminated area. Throw that away. Squeeze that out. Least contaminated to most contaminated. Throw that away. Do the outside. Throw that away. And the other side. Throw that away. Okay, now I'm going to go ahead and measure my wound. Okay. Use this Q-tip. Measure the length first without touching the wound. And without touching my measuring device. I would say it's about 13.5 centimeters to 14. And I'm going to measure my diameter without touching the wound as well. Without touching this measuring device. It's about 3 centimeters. And now I'm going to test my depth, and I'm going to moisten the Q-tip to this without having it drip everywhere. I'm going to line it up with the edge. See, like the depth is about 3 centimeters as well. Okay, I'm going to throw that away. And now I'm going to check for the tunneling using the moisten Q-tip. Make sure it doesn't drip everywhere. Let's see. And I don't see any tunneling present. And I'll throw that away as well. Now we'll go on now to packing my wound. Go ahead and fluff this out. And now I'll moisten it. Squeeze everything out. Make sure it's moistened. And I would use another Q-tip. I don't have one now, but I would go and get one, and I would use the Q-tip to pack down the gauze inside. And I would get another one and fluff it out. Moisten it. Squeeze the excess out. Fluff it again. And use the Q-tip as well to pack this down. Okay. And I would then grab another 4x4 gauze to place over it, and I'll put 2 in. Place my ABD pad over. And I'm okay to throw away my gloves. Without touching the outside. Throw those away. And I will go ahead and take my wound down. Put it on there nice and neatly. I would get a piece of tape and put that on top, and I would date and initial the time that I've given it. I'll place that on top. And now I would raise the bed back down for the patient and put the side rails back up. Okay. And I would go ahead and cover them back up. And I would put on new gloves. And I'll also put the call light here for the patient. And put on new gloves so that I can discard my materials I have used. Go ahead and lift this up. Put this in the bag. And I would discard this in the proper container. And then I would go and document my findings of the wound dressing. I would document the patient's tolerance after we were done. I would document the amount of discharge that had come out, if there was excess discharge. I would document the color, the smell of the wound as I was dressing it, and when I took everything off, I would document how many gauze and how many the pads that I put on there, and also how much drainage, the amount, color, and odor that was on the ABD pad and the gauze when I removed the dressing, when I was changing it as well. And then I would make sure the patient was okay, and that would be all.